Just a quick reminder, this podcast is general information only and doesn't replace medical advice. Always speak with your treating team to know what's right for you.
I think that's really important, that it's not a prophecy and it may not be related to the medication that you're taking. One's genetic makeup, your lifestyle, your other medications, your medical history, all will contribute potentially on whether or not you develop a specific side effect.
Welcome to Beyond the Count. I'm the founder and CEO of ITP Australia and New Zealand and your host, Danielle Boyle. This is a space created for the ITP community by the ITP community, where we share real stories, expert insights, and everything in between. Whether you're living with immune thrombocytopenia, supporting someone who is, or just trying to understand what life looks like beyond the bruises and the blood tests, you're in the right place. Today, you're listening to our 4-part series on Decoding Risk, designed to help you make sense of ITP treatments, side effects, and the information that can sometimes feel overwhelming. If you've ever read the side effects list and felt your stomach drop or wondered, how do I even know what's normal and what's not, you're not alone. Across this series, I'm joined by Dr Danny Hsu, consultant haematologist and medical advisor to ITP Australia and New Zealand. And we're breaking it down in a way that's clear, practical, and reassuring. So whether you're driving, out for a walk, folding the laundry, or just sitting back and tuning in, let's dive in and go beyond the count together. In today's episode of our Decoding Risk series, we're talking about something that can feel incredibly overwhelming, regardless of you having ITP or not: medication leaflets. You know the ones. You open them up and they're massive. The font is tiny, and suddenly you're looking at this long list of side effects and thinking, how is this even safe? In this conversation, Dr Danny Hsu walks us through why those leaflets actually look like the way they do. And it comes down to how clinical trials are run and how information is reported. We also touch on how easy it is to get caught up in the worst case scenarios, whether that's from the leaflets or something you've seen online, and how to start putting that information back into context. If you've ever opened one of those leaflets and felt completely overwhelmed, this episode is here to help you make sense of it all. So let's get started. Welcome back, Danny, for joining us for the Decoding Risk series.
Oh, pleasure. Thank you for having me again on the podcast, Danny.
Wonderful, wonderful. Now, in this episode, we're actually going to be talking about why medication leaflets look so terrifying. You know, they open up and they could almost be the size of a tarp. Yep. Like some of them, they are huge. And the font on them is getting so small. Oh, my goodness. Yep. So, but we'll be actually touching on those particular leaflets and understanding, I think, what they're saying and understanding risk. Especially when it comes to ITP treatments. So let's start with why do they look so terrifying? Can you tell me why? Why does it have to have every single thing known to man on these leaflets?
Yep. No, and look, it's absolutely daunting, isn't it, and overwhelming when you see that massive list. And I'll tell you the background behind it. So before a drug essentially gets onto the market and really approved by the TGA and then obviously backed by the PBS for our patients, it goes through a series of clinical trial testing. And there's various phases of clinical trials, starting from phase 1, where it's the first in humans, to phase 3, which are the big randomized controlled trials that are generally international, involving multiple centers all around the world, lots of patients, and potentially compared to placebo treatments or standard of care treatments to really, in a way, prove that, number one, that drug works, but probably more importantly, that drug is safe. Now, throughout that clinical trial process, any patient that reports any side effects, whether or not is related to the drug, the placebo, or the cup of coffee they had, as a clinical trial doctor, we have to report every single one of those symptoms and signs. So that's why they're so long, because they all end up being included in sort of the product information leaflets, because we have to document everything. Where it's fascinating with my clinical trial hat on, what I tell my patients is that the whole premise of clinical trials, the number one most important thing actually is patient safety. So that list stems from really ensuring that our patients are safe, and really you're going into this with their eyes wide open in clinical trials. Whatever has been reported in whatever phase trial there is, they'll in a way know what they're kind of getting into.
Yeah. And someone that's been on a clinical trial, every sniffle we had to have our weighed and blood pressure and, all of those sort of standard, scratches, everything had to be reported and was on that list in the end. So why, I suppose, when it comes to from a clinical trial perspective, and then it all ends up in this paperwork, what does it mean when the leaflet says 1 in 9 people experienced X?
Yep. So really, what that is telling us is that from all the patients that were really in, I guess, the trials, they've experienced that particular symptom or sign. Now, it is not a prophecy, right? So it's not saying that you're definitely going to be that 1 in 9, very importantly. And also, here's the thing. So I think I sort of alluded to this in my previous comments, where we report every side effect. As a part of that during the clinical trial process, we got to actually assign, do we think is related or unrelated to the trial medication that the patients are taking. Even if it's unrelated, it ends up on that leaflet, right? So I think that's really, really important. And buried probably somewhere in there would be somewhere a table potentially that actually may have then the very, very, very rare side effects that we think are related to the medications, right?
Yeah.
So I think that's really important, that it's not a prophecy, and it may not be related to the medication that you're taking, but it's just been observed in the trials that some people have developed that particular, side effect. And we know, of course, one's genetic makeup, your lifestyle, your other medications, your medical history, all will contribute potentially on whether or not you develop a specific side effect.
So even things like your comorbidities and what you're currently experiencing, you touched on lifestyle and genetics as well. All of that information gets included regardless of it being on a trial. So when you guys report it, I suppose, and this is just from a patient perspective, is there a way of saying, or you guys saying, that this actually isn't because of the clinical trial drug, or is it something that is just, no, this is the list?
Yeah, great question, Danny. I think those of us who, obviously prescribe the medications and with experience, we come to identify which are the ones that are definitely related to the medication, and ones that we think are clinically significant enough that we raise, I think, with our patients to say, look, there's a long list. In my normal counselling, I guess, to my patients, I would say it's a long list of side effects. Please don't be alarmed. A lot of those might not be related to drug, but these are the specific ones that I think are clinically significant that I want you to be aware of. And then I'll outline them and talk about really how likely and how the incidence and what is the actual chance of develop these side effects, whether it's common or going to be rare.
And the other thing too is that even with some of these particular side effects and with some of these elements, they can potentially even be alleviated or mitigated through really good hydration and lifestyle choices and eating right and those sorts of things as well. So I think that it's, especially if you're on a clinical trial, regardless of seeing this leaflet, down the track. But I think when you're on a clinical trial, doing, what's right for your body at that time, I think is really important.
Thanks to our sponsor Sobi for their ongoing support of ITP Australia and New Zealand and our podcast Beyond the Count.
So taking this back to the leaflet, what should patients focus on? What should they ignore? And I suppose how do we navigate it? How do we navigate this big tarp of information?
Yeah, I think that's a great question, isn't it? So my probably two main tips is that, well, look for what are the common side effects are, but probably more important is look at the severity, actually, because generally they'll tell you the severity of those side effects. And generally this is graded between grade 1 to grade 4, grade 4 being the most severe. So if you see that, oh gosh, this medication has a long list of common side effects, but most of them are grade 1 or even grade 2, they're generally what we'll consider to be quite more milder side effects. And really, I think another tip then is to ask the clinician, what is the natural history of side effects? Because I would, in my experience, most of those mild side effects are self-limiting, right? They're ones where somehow when you first take the medication, you might get a little bit of tummy upset or whatnot, and then it settles down over a few weeks. And the clinician might with their experience, tell you that, is that, hey, look, yes, it says it's common, but you know what? In the majority of our patients, that only lasts maybe a week or two. Not to worry about it. That let us know, of course, if it persists, but it's generally going to be mild, and it's something that won't really cause a long-term issue. I think a good question to ask sometimes as well for a new treatment is, what do people discontinue medication for the side effects? I think that's a very good question, because that would tell you, well, okay, that is a side effect that you can develop on this drug that make people stop, right? So I think that's something might be a good question to sort of tease out from your clinician. What is it they're worried about in me as a side effect that they will stop, don't want to stop the medication potentially.
One of the things that we do see within the patient community as well, especially online with all of this technology now, is, patients asking others, I'm about to start X treatment or X clinical trial or whatever. What have others experienced? And I think the other thing that we need to remember is, from a patient perspective, pediatrics versus adults different.
Absolutely.
We definitely do need to remember that. So if you're asking specifically about your child, these answers are going to be a little bit different to adults living with ITP. But I think too is that we also need to remember, especially in a digital age, that we have to put everything into a sieve and use it as a guide. It's not gospel. It's not the Bible. Just because something happened to somebody else, it doesn't mean it's necessarily going to happen to you. And you don't know until you've made the decision to actually undergo that treatment.
Yeah, I think that's a really great point, Danny. And I certainly have seen this phenomenon too, where I have patients obviously who've hopped online forums or chat groups, and they tell us, oh gosh, someone's had a horrendous side effect to this medication you want to start me on. And what I tell them is that, look, yes, these things can happen, but remember, on these forums and these patient forums and whatnot, what's going to stick in your mind is the very bad side effects.
The bad stuff.
The bad stuff. But what we not going to hear from is then all the other patients who have zero side effects from it, right? Because they didn't
get any. They got nothing, no feedback.
There's no feedback. So I guess that's the one point that I want to sort of make, that just be wary that you read sort of people posting horrendous side effects, but just remember there's probably much more patients out there who had no issues with that particular medication. They're not posting that, right? So yeah.
And the other thing too is that from a patient perspective, we're not doctors, we're not clinicians, we're not. Yes, we live with this disease, every single day, but we may attribute a side effect or a symptom to a particular treatment, but it could be something completely disconnected and, on stage left, right? It can actually be something else going on that you haven't necessarily, is not diagnosed, or you're unsure of what's going on. So we need to take that information into consideration as well.
Yeah, absolutely.
Yeah. So personally now, looking at perimenopause and the overlaps of some of the symptoms and side effects from treatments to perimenopause, there is an overlay of symptoms and, impacts. And I can't definitively say this is an ITP fatigue or this is a perimenopause fatigue, because fatigue is fatigue. when it comes to that sort of stuff. So understanding what the actual underlying problem is, as opposed to, making those assumptions. That's where it's really important to have those conversations with your clinician. You guys have done many years of training. And continue to do it every day. You're learning every day. You guys are the experts. And again, have a chat with you guys, because you'll know, is this a side effect, or is this a risk? And then, maybe we need to get you a second opinion, or maybe we need to get you an appointment for a different specialist, or talk to your GP, or so on and so forth as well. Yeah, we're not the experts. That's what we've got you guys in the room for.
Yep.
Definitely, it's not the sort of thing that should be sort of left alone. Definitely have a chat. Definitely communicate, but understand that those pieces of paper are massive, and there's method to the madness, if we can put it nicely.
There is. Absolutely. Yep.
Well, thank you so much, Danny, again for joining us on the podcast, and we'll definitely see you for the next episode. Look forward to speaking to you again shortly.
No, thank you for having me, Danny, and look forward to the next episode. Thank you.
I hope you all got a lot out of today's episode. Before we wrap up, here are 4 key takeaways from our conversation with Danny. Number 1, leaflets are long because everything gets reported, even things that may not even be related to the drug itself. Number 2, population data isn't a prediction about you. When you see something like 1 in 9 people experience this, it's based on a large group of people in a trial. It's not a guarantee that you'll experience it yourself. Your experience will always be as individual as you are. Number 3, not everything on the list is actually caused by the medication. Focus on the common sections, and if severity is listed, pay attention to that. It helps you separate uncomfortable but mild and rare but important information. But remember, your perception of common, rare and very rare is very likely to differ from the scientific meaning, and we'll cover this in our upcoming episode. Number 4, don't rely solely on other people's experience. What you see in online forums tends to highlight the worst case scenario. Often people who have had no side effects don't post. So what you're reading isn't a full picture. And just because something happened to someone else, it doesn't mean it will definitely happen to you. A big thank you to Dr Danny Hsu for joining us for this Decoding Risk series, and for explaining complex topics in a way that feels clear, calming and genuinely reassuring for our community. Thank you for joining us for this episode of the Decoding Risk series. If you're following along, the other episodes in this series include why side effects happen, the words that trick our brains, and becoming a partner in your care. If you'd like to watch Danny's presentation from the 2026 ITP Australia and New Zealand Patient Conference in Melbourne, you can find it on the ITP ANZ YouTube channel. And don't forget, if you're looking for support, join the ITP community at itpanz.org.au. While you're there, check out the latest edition of The Count, our quarterly magazine, read some patient stories, download a huge range of treatment information and guides and more from our patient resources section, and know that you are not alone. We're here to support you, guide you and keep you informed of the latest information when it comes to immune thrombocytopenia. If you found this episode helpful, please share it with others in the ITP community, and don't forget to leave a review on the platform you're listening from. It helps others find the Beyond the Count series. We've got more expert conversations coming your way soon, so hit the follow or subscribe and stay updated. And thanks for tuning in and diving beyond the count with us.